Good afternoon, everyone. It is 2 p.m. Let's get started. Welcome to Cook County Health Department School Health Update. My name is Kelly Jones. I am a health educator senior with Cook County Health Department, and I am your facilitator and moderator for these webinars. Before we get started, I would like to welcome Alicia Boyd, who is the new Director of Community Engagement for Cook County Health Department. She is my new supervisor. Some of you remember Deidre Reese, who is no longer with the agency. So I just like to welcome Alicia, and she'd like to say a couple words.
Good afternoon, everyone. Thank you. Thank you for the warm welcome. Just stopping by to say hi. And also, I've been hearing about the great work that you all have been doing and the progress of these meetings. And I'm super excited to be a part of the work that you're doing. So thank you for your support.
Thanks, Alicia. We're excited to have you on the team. Let's get going. We have a full agenda for you today. Our meeting objectives are to share updates, information, and resources to help schools navigate school health issues. We answer any frequently asked questions and provide CCDPH contact information and resources. All of our webinars are recorded and they are uploaded to CCDPH's website as well as our YouTube page for watching after. I understand that everyone can't log on at 2 p.m., but you can watch it on demand at your leisure. Please keep your lines muted. Feel free to ask any questions in the chat, and we'll be sure to answer those questions. On today's agenda, we have announcements and some resources, an update from our communicable disease team, as well as an update from our chronic disease team, and a presentation on signs and symptoms of child abuse. Welcome, April. I see your wonderful welcome in the chat. It's greatly appreciated. A few announcements. If you are looking to contact CCDPH and you have any webinar related questions or any general questions, you can contact the Healthy Cook at cookcountyhhs.org email. If you'd like to submit line lists, report communicable diseases, you have any metrics questions for our communicable disease staff, you can reach them at ccdph_schools at cookcountyhhs.org. Here is our Cook County Health Department website, as well as our school-specific website, and any information on vaccines on our website. Our last meeting, Kelly Bemis from Communicable Disease did a presentation on the Shiny app that Cook County Health Department has. You can look up the status of vaccines and communicable diseases within your region on the Shiny app. So I've added a slide with that link for those who are interested in checking that out. For anyone that you may come in contact with who is not insured or underinsured and they'd like to seek treatment for any reason, they can go to Cook County Health Systems, and we have all of our locations listed. We do not turn away anyone for inability to pay. So all of our locations with their contact information is listed here. A few events and resources. Alicia had a hand in organizing this in her previous role, but Providence Hospital has allied health and undergraduate scholarships for those seeking health majors, $10,000 for undergrad and $20,000 for those who are in graduate school for health professional. It closes May 10th, coming up soon. The link is at the bottom of the slide. Please share it widely. I came across this resource, and I think it is great. Varsity Tutors empower students through education, and they have free tutoring based on your eligibility of your school district. So you can contact Kevin Brown at the email address below to find out whether your school district qualifies and how you can take advantage of those resources. A couple of summertime kickoff events that are happening. I'm a part of the steering committee for this event. Next week, Park Forest Richton Park Neighborhood Network is having a Safe Summer Kickoff event. There'll be some vendors and some summer programming available. You can bring your family out and see how you can sign your little one up or your big one up for any Safe Summer events. NAMI South Chicago Suburbs is having a mental health fair May 18th. There is a health fair tomorrow in the Southland. Wellness. There are wellness workshops. There's going to be dental screenings, health screenings. So please take full advantage and share with any partners that you may have. Mental health first aid is a way that you or your organization can find out more information on how you can support people who may be challenged by mental health before they can get to a professional. So these are free classes that you can take advantage of. CETA, South Chicagoland, is doing a community needs assessment and would like a wide range of opinions on how they can better serve the community. So they have shared their survey. Please share the survey, fill out the survey, and I will also put the link into the slides. I'm sorry, into the attachments when I share out the slides later on. CCDPH, in partnership with the Illinois Public Health Institute, has been putting on professional development trainings. The last one is coming up this coming Tuesday. It'll be a computer-based training at Moraine Valley. I know that some of the school nurses have told me they could use a few assistants with getting their computer skills up. So this is a great opportunity if you can attend. As you all know, I am the coordinator, point of contact for the EpiPen and the albuterol program for Cook County Health Department. Please send me all your requests to kjones1@cookcountyhhs.org. Those requests should come from a medical professional or someone who has been trained on the administration of medication. There is a new form requirement. For those of you who have been here a long time, you understand this form, but new people may not be aware that there's a documentation of training form that must be submitted. Someone from your organization has to have been trained either by the school nurse or by a organization to state that they have been trained on how to administer medication, and you must document at least 2 professionals from your organization with that request. And Keith Wynn is going to come on and give us a few updates on that program a little later in our program. Here is just some resources that I've gathered, some frequently asked questions that I usually get. So I've gathered some resources to help with that. Some schools are automatically opted into the Rescue Illinois albuterol program. You may have automatically received the materials, and some people contact me asking questions because they are unsure about the program. You can contact Naomi Soto with Asthma and Allergy Foundation. If you are enrolled, you can get that standing order from Naomi and get all the contact information about how that program works. If you aren't enrolled, you can still get that from us. Anyone who is reaching out to seek Narcan can contact Denise Holman with Cook County Health Department, and she can give you all the information about how to secure the Narcan for your school or your program. As we all know, there's been a bit of an uptick in positive measles cases. Sheila Giovanni will give us an update after the resources, but I just wanted to share a press release that our communications department sent out earlier this week. It's just naming the locations and the areas that there have been some positive cases. You may or may not know there was a positive case identified at the Sam's Club in Evergreen Park yesterday. And you can find out more information on our website. And here's just measles fact sheets we went over in detail at our last meeting, but I'm going to attach these fact sheets as well to our slides when we hand them out. You are aware about our Boost Up campaign, where we are raising awareness for boosting up, not just for your COVID vaccine. We want to make sure that you have all of your vaccines up to date, including your flu shots, your COVID boosters, as well as any childhood immunizations that may have expired or you may have neglected to get. So here's information on our Boost Up campaign and some information on how you can get free COVID tests from the US government, covidtest.gov. You can go on and get 4 per household. There's no limit to how many you can request. You can also request in bulk from Cook County Health Department. You can request antigen tests as well as PPE. And here's our information on how to request that. I've had some schools in the past tell me that they had some issues getting their immunization up to date for families. So we provided these mobile vaccination resources that you can contact. This is a good time to contact them now if you want them for back to school, because their calendars book up very quickly. So it's a good time to contact them if you would like to have some back to school events going on and would like to have those mobile vaccination professionals there, and including IDPH has a wellness on wheels. A couple more resources. Last month, people were asking about how you can dispose of medication. The DEA is having medication take back next Saturday. Their website is here, and you can find out more information about those locations with how to do those medication drop-offs. and some more resources that I have gathered to share with schools that would be a good addition to any programming that you have, including mental health programs or any suicide and crisis lifeline, as well as the 211 crisis line. I am going to just slide through these slides very quickly because we go over them every week. I want to make sure everyone has them, as well as one slide with the concise web links that I went over earlier. So I will stop sharing and I will toss it over to Sheila Giovanni, who is going to give our communicable disease update. Hi, Sheila.
Hi, Kelly. How are you?
Great. How about yourself? Happy
I'm
Friday.
well. Happy Friday. Happy Friday. Okay, I am going to present. Please let me know when you can see my slides.
I can see it. You're good to go.
Okay, great. Thank you very much. And good afternoon, everyone. Just wanted to take a moment to provide you guys with some information that came out in our Illinois Department of Public Health Siren on April the 4th. I believe that is the specific date in regards to the action of what can schools do in regards to our Illinois measles outbreak call to action. So this siren was specifically dedicated to our preschools, daycares, and schools K through 12. But before we get started with that, I do want to make note of a couple of things. So if you have any questions for me specifically, please feel free to put them in the chat. I need a moment to ponder sometime with these questions. And if any of my staff are on, and feel free to answer any questions in the chat, that is absolutely great. And then secondly, I wanted to take a moment to give an update in regards to where we are in suburban Cook County for measles cases. So currently we have 2 confirmed measles cases within suburban Cook County area as of today. We are still working very diligently to investigate suspected contacts of Chicago Health Department, as well as just a few community exposures that may have come our way in regards to measles confirmatory tests. So, again, with that being stated, I just want to be very clear because I know that there's been a lot of exposure that has been taking place in suburban Cook County, but currently we are at 2 cases. So let's do a refresher, if I may, to talk a little bit again about what measles is. So measles is an airborne disease, and it is spread easily through the air when an affected person coughs or sneezes. Again, it is highly contagious, and it can be transmitted through breathing, coughing, sneezing, again, making this a very serious public health concern. Some of the symptoms normally begin about 10 days after the exposure. It's actually that window between like 10 to 12 days or so that symptoms start to exhibit after exposure. Those prodromal symptoms of measles is usually a fever at like 101, cough, coryza, conjunctivitis, and they normally last about 4 days. Some have experience with copeland spots, which are these like white little dots that are in the mouth and the roof of the mouth. And then they're very unique to measles just in general. And then a person is considered contagious 4 days before the onset of the rash and then 4 days after. Just that refresher. So I wanted to share the slide with you guys, and it looks a little small on my part. So I'm more than happy to discuss this in general. As I had just stated, in suburban Cook County, we have 2 cases. So this breaks down our jurisdictions based on the counties in Illinois. I do want to note that this data was pulled April the 15th, so it's already a couple days behind. So while our numbers are true for suburban Cook County, I'm thinking Chicago numbers are escalated past that 58, which that gives us a total of 64 cases as of April the 15th in 2024. for our for our Illinois area, with that 58 being in Chicago, DePage 1, Lake 1, Suburban Cook County 2, and Will County 2. And again, this is in reference to confirm measles cases. So the call to action that the siren spoke upon in regards to our Illinois schools is for everyone to take a moment in this heightened, elevated stage where we're seeing so many measles cases. And let me just take a moment to project, if I may, and talk a little bit about the significance behind this. So we had an outbreak that I discussed on a previous webinar for suburban Cook County in October, November. That was 5 confirmed cases that were in one specific apartment unit building, and it was isolated. We had no additional cases. Before that exposure, the first cases that we had for measles was back in 2015 for a confirmed positive case for measles. So for us to be in April of 2024 and seeing 64 cases and climbing, it's a serious concern to us, not only in the state of Illinois, but United States in general, because we're seeing more cases than we have all last year combined. And again, before that outbreak that occurred in October, November, suburban Cook County did not have a positive confirmed case for measles since 2015. So with that being said, and this renewed if I may highlight, of measles, the siren calls to action for all schools to take a moment to review the immunization records for all of the students there. It would be a great opportunity to check and see if they have at least 1 dose of MMR for daycare students in preschool. And that would be, again, that less than 12 years. Less than 12 months with that daycare age and that preschool age. It gets them at 1 dose of MMR, because the second dose of MMR isn't normally given until the ages of 4 to 6 years of age. So that's where that 2 doses of MMR vaccination come in for students grade K through 12. So it has been asked that if you guys can please conduct and do a acceptability list. And what that would look like is making a list of all of the students and staff that are within your school, and make the list based on disease category. So perhaps one list for varicella, another list for measles, et cetera. And then identify those students who are not fully vaccinated, and then check their files for immunization records. Is there any exemptions on file that may be religious or medical exemptions that are excluding them? Or do you have individuals that are just non-compliant, and perhaps you need to reach out to them to encourage them to get vaccinated? And then it also calls to action for schools to review their policies in place in regards to exposures, in regards to vaccination records, and the Illinois Administrative Code Part 691 is available. No links is provided for this specific information, because I do believe that the siren attachment will be included with all of the information that is provided to you at the end of the presentation. And if not, I'll be more than happy to give Callie a copy so that you can have all of the information that is being discussed today. And if you want to, go ahead and review those Illinois administrative codes in detail. What this actually help do is it really helps you be more prepared, right? So if you are having that confirmed measles case within your school, or confirmed varicella case within your school, it can help you easily identify those individuals that are not fully vaccinated versus those that are. And then you can focus your effort on those individuals, as well as the individuals that have exemptions, regardless if they are religious or medical exemptions. If they're not fully vaccinated, and there is a direct exposure to a confirmed case during that susceptibility time, that is grounds for up to 21 days of exclusion from school. So it's like really good to have that information available so you can know specifically who those students may be that may need that exclusion letter, as well as those that are non-compliant. Again, a great opportunity to encourage vaccinations. So this is our measles notification. It is something that we literally discuss all the time. I think it's widely noted that if there is a measles case, it needs to be reported to the local health department immediately. But I did want to take an opportunity just to kind of discuss why this is like really so important, because our VPD team has a running joke that if you see measles, run. And I think this is from my colleague Tarek that made that comment, unless you're vaccinated, right? Because there is a lot of work that goes into investigating a measles confirmed case. And there is this wonderful illustration that is an iceberg. And I think I took it from my boss, Damien, that he had on one of his slides. And I'm sorry I didn't include it here. But it really gives a great depiction of what one case confirmed case would look like. So it's like at the tip of the iceberg, but then below the water level, it is a bunch of contacts. So one confirmed case could bring hundreds of contacts that we would have to investigate. So when we're looking at providing like PPE for individuals or giving immunoglobulin to babies, that may require it, time is of essence in providing these preventative strategies. So it's very imperative to make sure that any measles exposure, susceptibility, contacts, any suspected measles and confirmed cases be reported to us as soon as possible. And then definitely want to note that, we work very hard to assess our health partners with testing when measles is suspected. So that is definitely something else that we do as well. So of course, I had to keep this slide in, right? It is vaccination is the key. And that we cannot stress enough. I've been asked many of times, like, what can we do? Like, what is the preventive strategy to protect us from measles? And I cannot stress enough is vaccinations. We have vaccinations that are ready and available, long-standing, effective, safe, that provides protection against measles. And one dose of MMR provides 93% effectiveness. 2 doses provide 97% effectiveness. So again, I definitely urge individuals to make sure that they're vaccinated, which brings me to my very next slide. So a couple things. We have our eye care, which is our Illinois Comprehensive Automatic Immunization Registry Exchange. That was like a mouthful, but it's eye care. And if you guys are not familiar with eye care, you should get familiar with eye care. It actually provides a lot of grateful information in regards to tools and resources for identifying individuals that are vaccinated. And it is just not measles. It's a whole list of all childhood vaccinations, including like COVID and the flu, and it provides information that shows a person's vaccination status. So here's some information for new organizations to complete the site enrollment form for current organizations that can report site updates and PRA changes. And then individuals can request eye care access as well. So again, the link is provided here, but it will be, this information will also be available more in detail on the document that will be provided to you guys later. So this is something that I really wanted to take a moment to talk about, because I have been a lot of phone calls lately with nurses and school administration staff that are wanting to know a lot about measles. And we definitely appreciate that. And then they're wanting to know if they have a case, what does that look like? What is the outbreak definition? But most importantly, are they breaking any HIPAA laws when they don't have the information available for their staff? Not students, but staff. And then they have staff that's stating, oh, I believe I was vaccinated, or yeah, I was vaccinated. I have the 2 doses, but there's like no way that they can verify that information. This is some information on our online access through IDPH that's called Vax Verify, and it gives you the opportunity to access your records for your individual shot records. So what I do love about this is that they do have authorization to release the immunization records for individuals in English and Spanish. So I have provided that direct link for you guys. If you're not familiar with Vax Verify, please make note of that as well. So I wanted to also take a moment. I think this is like super cool, guys. And I'm going to be very transparent. I only had a little time to play around with this, but it is readily available on IDPH website, and it is our school vaccination coverage dashboard. So I am going to go ahead and click on this link and do a little demo for you guys. But my overall thought process with this and my mindset is to get you thinking, like, what do you know about your school vaccination threshold? Interesting, huh? So let me know when you guys can see my screen. Kelly?
I can see it, Sheila. You're
Okay,
good.
great. Thank you very
Great.
much. I appreciate that. Okay, guys, so this is our school vaccination coverage dashboard. I think it's like super cool. It actually provides the Illinois school vaccination coverage per your county. So a couple of things I want to note here. It is definitely here noted for 2022-2023 school year, and it gives the threshold of what coverage you have within your county and your school based on a specific disease category, right? So let's just take a look and dive into this. So I do want to point out just, for your reference, there's a lot of 2 buttons up here that you can definitely use. And this download PDF button literally can provide you with a report, which I think is extremely very helpful. But if you go here and you hover over any specific area, and I don't want to call out anybody in general, but they're color coded, right? And it provides the blue, the yellow, and of course the red in regards to where people are in regards to their vaccination status. So for instance, let's look at Pope. Pope has a number of schools reporting in that area. There's 2 schools. The average county projection is 88.80, and this is for chickenpox and varicella. So keeping in mind that the high is 90%, the medium is or middle is 86 to 90%, and then the low is 86%. So what this gives you an indication of is that if you go down here a little bit, let's see if I can move this, it gives you an opportunity to benchmark, right? So if you want to benchmark your school based on that county area and that threshold with others, say, state, county, or even district, it gives you the opportunity to do that. And I think that's like a really cool. So if we go up here and then we click on where it says chickenpox and varicella, you go here to the upper right-hand corner, you hit filter. Let's check out where we are with measles. So it gives you the school year. Of course, we don't have the data for 2024 yet, but the most current is 2022 to 2023. It breaks down the vaccines based on, like we were just in chickenpox. If you want to find out about mumps or rubella, but let's just click measles for now. And then here's the counties, which of course there's quite a bit. You can look by zip code, district. It's just a lot of different options that it provides you here. If I keep going down, there is stuff information based on the facility name and rural or urban. But for the sake of this and my knowledge base, we're going to go ahead and we're going to click on the measles, and then we're going to close this. So it's going to populate. And as if you noted, we're still in that school year of 2022, 2023. And it actually has measles now. So then if you go here and you look, let me see if I can make this a little bit bigger. And if you look, you note that the areas and yellow, of course, it lets you know where their average protection is. And of course, from my understanding, that the threshold that we're looking for schools to have coverage, of course, would be that 96 or greater. That is, ideal. But then it also gives you an opportunity to look at those schools that may not have that coverage protection that we're looking for, that may be a little bit low. And then you can dive down a little bit deeper saying, I'm in the low category. Like, why is that? Do we have a lot of exemptions on file? Or are we looking at maybe perhaps a lot of non-compliance? It just gives you an opportunity to dig a little bit deeper in your community immunizations threshold and look and see where you guys are. So again, if we go here, this is Clark. So Clark has 8 schools reporting, and their average protection is 99.17. That's like really great. So they're over that threshold of 96%. So we note that in Clark County that they have an abundance of coverage in regards to vaccination protection in that specific area. So I did want to point this out to you. The link is provided in that slide deck, and as well as on the document that I will be sending you later, so that you can come here directly on IDPH side and look at your school vaccination coverage through this wonderful, user-friendly coverage dashboard. So that is it for me, Callie. Thank you very much for that. Does anyone have any questions, or is there any questions in the chat?
Yes, Sheila, thank you so much. That was very informative, and that was a great tool, and I'm sure schools will use that. There are some questions in the chat. In the interest of time and staying on schedule, because we have 2 more presenters.
Oh yeah, we can
if your
answer
team could
those.
yes, if your
Yeah, we
team
can
could
answer them
those
in the chat.
There are quite a few
Yeah, sure
questions in the
thing.
chat. That would be fantastic. That was great, Sheila. Thank you so
No,
much.
thank you.
And I would thank you. It's always a pleasure. And I would like to welcome Keith Wynn, who would do a chronic disease update for Cook County Health Department. Welcome, Keith.
Hello, everyone. Hello, and glad to be here. So my name is Keith Wynn. I'm a public health educator with our chronic disease unit at CCDPH, filling in for our director, Amy Rourke. And I'm just here to share 2 announcements that would be particularly interesting and involve schools. And so I'm going to attempt to share my screen here. Okay. Kelly, can you see my screen?
Yes, I can see it.
Is it? Okay, thank you. Okay. So, okay. So the first announcement involves the uh, the announcement of the release of the summer electronic benefit program, is preferably called the EBT program. And so this program is it's a federal program um, that involves families, it offers the opportunity for low income families to buy groceries and foods through the use of a debit card to purchase these foods during the summer when school is out. And Illinois will participate in this program starting this summer. Um, and eligible children will receive, or households will receive a one-time benefit of $120 on this particular debit card. So this program aims to reduce childhood hunger that occurs in the summer months when, of course, when kids are not at school and not able to get food off of the free and reduced lunch programs. So this program is a partnership between ISBE and Illinois Department of Health and Human Services. And so ISBE's role is they will collect the required data from schools regarding that particular student's or household status based on requirements in a Illinois plan. They will then, through a data sharing agreement, share that information with IDHS, who will then be able to administer the debit cards. IDPH also would then provide technical assistance to schools about the summer EPT program, specifically those that are related to schools. And so if schools have any questions in regards to eligibility, how do I apply, the application, then that should be directed to ISBE. Human Services is the main coordinating agency in the state. And so they will be responsible once they get the information, everything's approved. They will then be responsible for the dissemination of those particular cards. And then moving forward, they will be the entity that will provide customer service to those families who have questions in regards to um, usage, the benefits, if they're having trouble using the card. Any questions like that will then come through or should be directed to Department of Human Services. And so this basically just who is eligible, as I mentioned earlier, um, any student or household that has children that qualify or are enrolled currently under the free and reduced school meals program. And just because there's still maybe some questions out there, and we just participated in a webinar this week on the program. So we just decided to provide the schools with a list of various resources that you can use to kind of go back and review. So you see, you started there's ISBE has a wealth of information and a toolkit on their particular website. There's also included a replay, review of slide presentations that have already been conducted by ISBE, and some previous web recordings as well too. And down at the bottom, there's some guidance for specifically for the parents and households in regards to the summer EBT program. The next announcement that we would like to share with the schools is pertains to the IDPH new standing order for stock asthma medication. So the new standing order allows the trained school personnel to use the asthma inhalers to treat students who are in respiratory distress, as many of you may know. But this new process, what it does, it will streamline the process for schools who are in need of a standing order. And so in the past or previously, schools, if they've been seeking a standing order or they're part enrolled in the Illinois Rescue Program, you had to get a standing order um, to be in order to disseminate the medication or obtain the medication. So what this does is this is just a standing order signed off by IDPH that would be updated annually that schools can use and access and pull down to fill out and complete in order to get their standing order. Um, um, so this standing order will enhance the efforts, as we mentioned, as Kelly already went into about information about the Rescue Illinois School Program. And if I can, a couple of minutes, Kelly, I'll try to bring up just an example. Uh, if I can kind of come out of this one and share my screen again. of the standing order. And so this will all be in your notes, and I've shared this with Kelly. So this is a copy of the current standing order. And as you can see, there is, if I scroll down to the bottom, it's already been signed by IDPH, and this is for 2024 and expires in February 2025. But as I said, it would be this will be renewed on an annual basis as well. And I have a press release here I can also show you too as well. Too as well, if that will come up. I don't think I have it up here. No, that's not it. Okay. So that's the link there. I can't find it. Actually can't bring that up, Kelly, at this particular point in time. But just wanted to take this time and this opportunity just to kind of share that information with the schools. And if they have any questions about both of those programs, we provided definitely a lot of resources for the schools definitely to follow up with it. So thank you, Kelly.
Thanks, Keith. That's some great information, and I'm sure it's a relief for the schools to be able to have that. If you wouldn't mind there, I see a question from Maria in the chat. Would you mind responding in the chat? In the interest of time, we're not going to answer the questions live, so we can go on to our next presenter.
Sure.
But that is fantastic information, and we appreciate that. And for our vaccine preventable disease team, there are some more questions in the chat in case you missed it that we would appreciate answering. While that is happening, I would like to welcome Belinda Farr, who works for Prevent Child Abuse Illinois and is a longtime friend of mine. She will present signs and symptoms of child abuse to the group. Welcome, Belinda. We're very happy to have you here. And I am also putting a survey link for today's training conducted by Belinda in the chat. I'll put it in multiple times, and we would appreciate the feedback on the presentation. Hi, Belinda.
Hello, let's see. You go ahead and try to share here. Sorry, I have it open, but I'm looking for my PowerPoint. It is open. There it is. Can you guys see that?
Yes, if you could just put that on presenter mode, that would be great.
Oh yeah, nope, I'm about to do that. It wouldn't let me do it before sharing. Okay. Well, good afternoon, everyone. Is that good now without the notes?
Yes, I can see it just fine. Thank you, Belinda.
Okay. Well, thank you everyone for joining us this afternoon in regard to child abuse and neglect. Just want to say that this is Child Abuse Prevention Month, National Child Abuse Prevention, which is in April. And so what today is the 19th. So we have a few more days. If you've done anything, you'd like to share pictures with us, we can post those on our website, on our Facebook page. And we did have Wear Blue Day, but you can still wear blue until the end of the month and take pictures with your staff. You want to submit those to me as well. And then we had like bakeries and restaurants who did blue goods. So we just had a lot of stuff going on this month for Child Abuse Prevention Month. So we're going to talk about child abuse and neglect today. Just hitting my advanced button, making sure it'll go. Just a minute. I'll try it this way.
Here it goes.
Yes, thank you. So overview of what we will go over this hour. Actually, also includes mandated reporting, but I'm not going to go over that part. So you can have that when Kelly shares the PowerPoint with you. So what is child abuse and neglect? And then recognizing red flags and warning signs. And so that's what we're going to talk about today. So just give you a few stats here. So these numbers only represent the reported cases. We know many cases go unreported. There are many more unreported cases during the pandemic when children were offline for school. And of those reported cases, 75% were victims of neglect. 15% of the victims are under the age of 1. And you can get some more information from the National Children's Alliance. So some Illinois stats. And you can find all of the Illinois stats on the state.illinois.us/DCFS. You can find these stats. So many calls don't have enough information for an investigation, and most investigations are not indicated for abuse, but families may be offered other services. And a few more stats here. And so just want to point out child sexual abuse. So 18,741 reported sexual abuse victims. Of those, 3,948 were indicated. And also, I'd also like to talk about and remember that sex trafficking is really happening in the state of Illinois, especially in metropolitan cities like Chicago, like around the United Center, around Midway Airport, around O'Hare Airport, and also definitely our shopping malls. Illinois has one of the lowest rates of children in substitute care in the U.S. Child deaths have risen overall in the past 3 years, and we usually average around 70 deaths per year. In fiscal year 13, we had 113 deaths. Fiscal year 14, there were 106. And fiscal year 15, we had 75 deaths. But of course, one is too many. So the information you're seeing here is taken from the DCFS website. So basically, there are 4 broad categories of child abuse legally recognized in Illinois. So we have physical abuse, sexual abuse, mental emotional abuse, and neglect. Neglect is the failure to provide for a child's basic needs, either emotional needs for love and acceptance or physical needs such as food, clothing, medical care, and safety for reasons other than poverty. Unsure if a child's injuries are the result of mistreatment or the mistreatment of a child is abuse or neglect, that places a child at risk of harm. Ask yourself some simple questions. If I witness a child being treated this way by a babysitter, teacher, or other caregivers rather than a parent or a relative, would I want someone to stop it? If a babysitter, teacher, or other caregivers were treating my child this way, would I want someone to stop it? If I were that child, would I want someone to help me? And what do your instincts tell you in the right thing to do, even if it's difficult? And so again, as mentioned, physical abuse, you may see basically non-accidental burns, broken bones. Sexual abuse includes fondling, intercourse, exploitation, and then mental emotional abuse, the screaming, the intimidating. And often I hear out maybe in the community sometimes just a parent calling the child out of their name and doing it on a regular basis and doing it so much that they don't even realize that they call their child out of their names. And then there's neglect. And we have to remember that poverty is a risk factor for neglect, but poverty is not neglect. And we have to be very careful with that. Poverty is a financial inability to provide a child's basic needs. So, sometimes getting in our way and our human selves, we definitely have to remember that poverty is not neglect. So who abuses children? Basically, it really doesn't matter. Um, Rich, poor, all racial ethnicities, educated, non-educated. We find most often in some cases that women abuse more than men when considering physical abuse and neglect. Men are more often the abusers in shaken baby syndrome and child sexual abuse. Abuse often happens in isolation. An abuser often keeps their family from having interaction with anyone outside the home. This lack of interaction with other family members or other children seriously affect the ability of the victim and children to share the secrets and to seek help. So just remember, that isolation thing, and they may not talk about it. But what I used to say when I did direct service, I've been in child welfare since 1993, that sometimes you get pieces of a puzzle, and you may 1 week get one piece. It may take a whole another month to get another piece. But sometimes children definitely give you little bits and pieces to build on in regard to what might be happening in their home. So risk factors. Living in a home where there is domestic violence, mental illness, poor parenting skills. Unfortunately, a lot of our young people don't really babysit anymore. Um, They may if they have younger siblings, but they don't know. They haven't been exposed to watching and caring for children that are younger than them. Risk factors for the children, a baby that has colic, so a baby that's crying all the time, they are definitely at a risk of child abuse. For someone who can't take the crying anymore. Children with special needs, physical or emotional, and then a child who was unplanned or unwanted could pose a risk factor for child abuse and neglect. Recognize the signs of abuse and neglect. Because each child reacts differently and is in his or her own unique situation, there is no way to tell if a child is being abused, neglected, or living in a violent home. Unfortunately, there's not a list of signs that is proof of a child being abused or living in an abusive home. Look for multiple red flags and behaviors that seem extreme. It is also important to watch for physical signs such as cuts, welts, and bruises, and other signs of physical and or sexual abuse. And unfortunately, sometimes in the classroom, you may have a child who you have no problems out of, no issues, don't act up, do their homework, gets good grades. But unfortunately, they may be that way because that's the only part of life that they can control. So we still have to be just mindful of all those students, those who may be acting out on a regular basis. And then again, also that child who is, for lack of a better description, one of your best students. But unfortunately, there still may be an issue there. So warning signs of abuse in children. Infants may experience frequent illness or sleep problems, excessive crying, or have an increased or decreased startle reflex. Toddlers and preschoolers may be extremely shy and withdrawn, or the opposite, and be very aggressive. They may have speech problems, loss of previously mastered skills, such as potty training, or may be reluctant to be touched. So, if you have a child that was potty trained and then they go in reverse, that's something you possibly have to definitely look at. So the warning signs in school-age children. Warning signs in school-age children may include all of the signs listed previously, such as speech problems, excessive crying, or reluctance to be touched, as well as increased aches, pains, headaches, stomach aches. It's not that the school-age children actually suffer more headaches and stomach aches than toddlers and infants, but now they can tell you about them. You might also suspect abuse or domestic violence if you see a child stealing or lying, displaying eating disorder, self-abusive behaviors, or extreme anger. Even children as young as 6 and 7 can have drug and alcohol problems as a result of living in an abusive home. And also, unfortunately, that might be that child that goes to the nurse's office several times a week, but she doesn't really find, any issues with that child. Warning signs in teens can again include all of the above signs, plus they may experience helplessness or hopelessness, anger and confusion, isolation, delinquent behavior, sexually acting out, or maybe in violent relationships of their own. An extremely serious and dangerous sign may be seen in children who think about, attempt, or complete suicide. So a few more things to watch for. So afraid to go home, inability to sleep or sleeping in inappropriate places, and the inability to empathize with others, doesn't value human life. So some signs of child sexual abuse. So the thing about child sexual abuse is a lot of times, unfortunately, people don't want to talk about it. But we definitely need to talk about it within our families, within your communities, that it's definitely happening. And we just have to talk about it, and then also letting people be aware that you are talking about it. Like, say for instance, in youth programming or in your church, you let them know we are aware. You can't have a child behind a closed door. We look into rooms, we check rooms, we want to see you interacting with these children in these programs. And a lot of times when you say those things, and also have a form for them to sign, let them know that we are aware and we stay aware and we want to keep our children safe. This is how we keep our children or decrease the incidence of child sexual abuse. As stated earlier, every child reacts differently to violence and trauma. Some emotional reactions may be severe and some may be subtle. Many children feel responsible for the violence or for not stopping it. Some may experience constant anxiety, worry, or guilt. Some may be oblivious towards the victim and the abuser or their lives. So what they may be feeling. Often children are confused about how they feel. Loneliness, shame, powerlessness, distrust, terror, anger, and rage are just some of the emotions that children experience. Sometimes they experience these all at the same time. And again, all types of feelings, but if they're experiencing abuse in the home and it's the mother or the father, children love their parents, you know, and just struggle with maybe, okay, why are they doing this to me? That's my mother, that's my father, but why is this happening to me? Or why are they doing it to me? And the parents are supposed to protect me. So responding to signs of child abuse and neglect. So what do you say to kids who experience abuse? It's not your fault. I'm not mad at you for telling me. Definitely, I believe you. It's okay to tell me what happened. Sometimes grown-ups say things to kids they shouldn't. Comfort to give space to the child and use the child's words and phrases. Well, please don't promise kids that everything will be okay. You definitely can't promise that because we don't know what the outcome may be. And more, what can you do? What else can you do to help children exposed to family violence? It's important to understand the trauma the child might be experiencing and the impact of that trauma on their brain development. Even if the child is no longer in this situation, they may be experiencing post-traumatic stress. It may help to structure the classroom environment to be non-threatening. This can include not having objects hanging from the ceiling, limiting loud noises, having a quiet corner, or allowing the child to find a place for their desk to feel safe. It's important to teach and model positive conflict resolution and relationship skills to show children respect, nonviolent ways to solve problems, respectful nonviolent ways. Teachers should always watch their tone of voice and be careful not to stand over the child or use threats and gestures. Children always also need to know that the violence is not their fault. They need to know it's okay to feel angry, but it's not okay to hit or hurt someone else. They need to know that they are not alone, that other families sometimes have the same problem. They need to know it's not their responsibility to stop the violence or to protect the victim. And they need to know that they are cared about and are deserved of love. All children deserve safe, nurturing environments. And let them know it's okay to feel angry. As I said before, learn alternative to abusive behavior because it's they've learned that, they've seen it. And then learn to tell someone they trust when they do not feel safe. So we talk about all the time, you probably hear it quite often, how resilient children can be. We have heard the expression that children are resilient. We can help children find and build their resiliency through exposure to more positive than negatives, helping them develop positive peer relationships, cultivating hobbies and other creative pursuits, development of an area where the child has personal control, and through the opportunities to help others. One well-known quote says it best: "Not all children exposed to violence suffer significant harmful effects. The most critical protective factor for a child is the existence of a strong, positive relationship between the child and a competent and caring adult." And so, as Kelly said, due to time, just want to share, some signs and symptoms and things to look for in regard to child abuse and neglect. Um, and let me know if you have any questions there, Kelly.
Belinda, that was fantastic. I was just going to ask for your contact information because I'm sure schools may want to call you to have you come out to do some more in-depth trainings for them. Can you, in addition to signs and symptoms of child abuse, what other programmings and trainings does PCA Illinois offer?
Um, So I myself, I am the certified safe baby trainer for the agency. So I am the shaken baby syndrome coordinator. I am the happiest baby on the block coordinator. And then we also have a very new but very informative training on safe sleep for babies. I also do a training on the effects of domestic violence on children. And then we have a substance abuse training and definitely a child sexual abuse prevention training.
That sounds great. Not much has changed. I was certified and happiest baby on the block myself. It works. It works. So,
It definitely does work.
it definitely does work. So if you have any questions for Belinda, please, you can unmute yourself or put them in the chat. Please let us know if your questions that you asked previously haven't been answered. We want everyone to get the information. And I put the link in the survey twice. Please fill out the survey for Belinda's presentation. We want to make sure that the powers that be know how much we appreciate her in-depth presentation, the great information that was shared. It's a scary world, but it's great to have that information so that we can remain informed. And for CAP Month, does PCA Illinois still do the fashion show and some of the other programs that they normally do?
Unfortunately, when COVID came, the Greater Federation Women's Clubs did do an amazing fashion show for us every April, and the money that they raised from that, they would give to the agency. We still work with their organization, but it hasn't gotten the momentum it had, unfortunately, prior to COVID. But they still do a lot of other things in regard to raising money and donating those funds to prevent child abuse in Illinois.
That's unfortunate, but that's great. There is a question, is the can'ts to be body chart required to be filled out by a nurse for every school report of abuse, even if the form is blank because there are not any visible injuries?
That form, actually, I would have to look that up and I'll share that with Kelly. Actually, we'll probably contact someone in DCP and see in regard to that, because I'm not sure of that answer for that.
That's a great question.
It is. But I know actually several DCP workers.
That is great. And if the schools, I'm sure the schools know, but if they suspect any child abuse, what is the number that they can call?
825 abuse. And I'm sure you guys already know, and as far as mandated reporting, schools have various protocols. And unfortunately, we've had cases in the past where the teacher has said, "I told the principal," and the principal did not call. But of course, that falls back on you. If the child reported to you and you report to the principal and you do not report, then that goes back to you. If anyone says, "Well, I reported it to Kelly," and Kelly said, "Well, I reported it to my supervisor," and the supervisor decided not to report, that will fall back on you as the person who initially received the report. So just please always remember that.
And even if you aren't sure, it's always best just to report it and let the investigators investigate. And they may find it unfounded, or you may have saved a life. So it's always good to just report it regardless, and then they can suss out whether it's verified or not.
Absolutely.
We really appreciate you, Belinda. That was a great presentation. And Belinda put her contact information in the chat, and her slides will be shared on Monday. I hope to collate everything and share the slides with all of our participants. And for those who want to see the information or miss some information, it will be uploaded to our website as well as our YouTube page. I want to thank everyone for taking the time out of their busy schedule to come out and attend our April I almost said Child Abuse Prevention Month. Forgot which job I'm at. Cook County Health Department's school health meeting. Please join us next month for our last webinar of the 2023-2024 school year. We appreciate that, and we will see you later. Be well, and thank you all for your participation. Thank you to Sheila, thank you for Keith, and thank you to Belinda for taking your time. And most of all, thank you for your partnerships. Have a great afternoon.
Thank you.
Thank you all.
Thank you.
Bye.